If NCLEX priority questions make you freeze, this video is for you. Most nursing students don't fail the NCLEX because they don't know the content. They fail because they don't understand prioritization. I'm going to teach you exactly how NCLEX decides who comes first, so you stop guessing and start answering with confidence. What prioritization really means on NCLEX. Let's clear up a major misunderstanding. Prioritization on NCLEX does not mean who is sickest in general. It means who is in the most immediate danger right now if you do nothing. NCLEX is not emotional. It is logical. It is focused on patient safety. Once you understand that, these questions become predictable. The number one rule of NCLEX priority questions. Here is the number one rule. Unstable patients come before stable patients. Always. A patient with a chronic condition who is stable will never come before a patient who is acutely unstable. Diagnosis does not equal priority. How NCLEX defines unstable. NCLEX considers a patient unstable when there is a threat to airway, breathing, circulation, safety. This is why you hear ABCs so much, because it works. Examples of instability include low oxygen saturation, abnormal breathing, low blood pressure, active bleeding, sudden change in mental status. If you see any of these, stop looking at the other answers. Stable versus unstable example. Let's make this real. Patient A has diabetes, blood glucose is 180, alert and stable. Patient B, post-op patient, oxygen saturation 88%, restless and tachypneic. Patient B is the priority. Why? Because hypoxia can kill faster than hyperglycemia. NCLEX always asks, what can harm the patient first? The expected versus unexpected rule. Another rule NCLEX loves. Expected findings are lower priority. Unexpected or worsening findings are higher priority. Example. A COPD patient with an oxygen saturation of 90% may be expected. A post-op patient with an oxygen saturation of 90% is not. Context matters. NCLEX does not test numbers, it tests judgment. The safety override. Here's a secret many students miss. Safety overrides everything. If one answer prevents harm, falls, aspiration, suicide risk, medication error, that answer usually wins. A confused patient trying to get out of bed is a higher priority than a patient waiting for pain medication. Because safety is immediate. What to do when two answers seem right? This is where students panic. When two answers look correct, ask this. Which patient will deteriorate first if I walk away? Not who needs education. Not who is uncomfortable. Who is at risk of serious harm right now? NCLEX rewards decisive, safe thinking. Common prioritization traps. Avoid these mistakes. Do not prioritize. Teaching during emergencies. Chronic problems over acute changes. Stable patients over unstable ones. Provider notifications before nursing interventions when the patient is crashing. NCLEX expects nurses to act. Prioritization is not about memorization. It's about safety, urgency, and common sense nursing. If you can answer this question, what will harm the patient first? You can answer NCLEX priority questions. Subscribe, turn on notifications, and comment below. I will pass NCLEX. Let's get you licensed.